In this episode of the Nurse Practitioner Podcast, Dr. Saribel Quinones discusses healthy discipline strategies. How did you become interested in child discipline?
Well, first, thank you so much for inviting me to have this conversation. I am a pediatric nurse practitioner and I have been practicing in primary care for over 25 years. I have also worked with child advocacy centers and foster care children. And throughout the years, I have seen how corporal punishment can negatively impact a child's life. Parents really want to do what is best for their child, all parents, and they want to learn how to discipline in a way that will be effective and will not hurt their kids. And as healthcare providers, nurse practitioners can help caregivers replace corporal punishment and other harsh parenting practices with positive parenting. In order for us to do that, we must first educate ourselves about specific discipline techniques appropriate for each developmental stage so that we can teach our parents and caregivers of our patients. Nurse practitioners are really in a unique position to affect change in parental behavior related to corporal punishment use.
Let's start with defining corporal punishment.
Absolutely. It is really important to define corporal punishment so that we can understand the difference between corporal punishment and physical abuse. Corporal punishment is defined as the use of physical force with the intention of causing a child to experience pain but not injury for the purposes of correction or control of a child's behavior. Corporal punishment most commonly involves spanking, hitting, or smacking a child. It is used with the intention to inflict pain without physical injury. On the other hand, physical abuse is when corporal punishment is used with the intention to inflict pain and cause physical injury. There is a long list of professional organizations that oppose corporal punishment while encouraging the use of positive, healthy discipline strategies. The American Psychological Association, the American Professional Society on the Abuse of Children, or APSAC, the International Association of Forensic Nurses, the AAP, just to name a few. More than 50 countries have enacted legislation to ban corporal punishment in the home, and more than 100 countries have banned corporal punishment in schools. In the United States, however, 19 states allow corporal punishment in schools, and the use of corporal punishment in American homes is widespread.
What are the negative consequences of corporal punishment?
We all know that corporal punishment improves immediate compliance. So, for example, if a parent spanks a 4-year-old because he or she said a bad word, the immediate effect is that that child will cry from being hit and will at the moment not repeat the bad word. However, corporal punishment does not lead to long-lasting changes in behavior. So going back to this 4-year-old, the chances that this child will say the bad word again at a later date is very high, because when a child is physically hurt, their brains and bodies focus on relieving the pain. They cannot simultaneously focus on the behavioral lessons that their parents are trying to teach. So we know from research that corporal punishment has many negative consequences, and I'm going to list a few. So the first one, research has shown that children who experience corporal punishment are at an increased risk to be physically abused. This occurs because as the parent is hitting the child, they can lose control, and what may have started out as corporal punishment can escalate to physical abuse. Another thing that research has shown us is that children that experience corporal punishment can develop externalizing behaviors such as physical aggression, delinquency, hyperactivity, and disruptive behaviors. We also have seen that corporal punishment disrupts the parent-child relationship, and that's kind of a given. Research has also shown that experiencing corporal punishment can impair the child's cognitive behavior. And several studies have shown that children that experience corporal punishment have poorer mental health outcomes extending into adulthood, such as depression, alcoholism, suicidal ideation, and low self-esteem. And even cardiovascular disease, arthritis, and obesity in adulthood have been linked to childhood exposure of corporal punishment.
Knowing what we know about the negative consequences of corporal punishment and that it really does not help improve child behavior, why is it that many parents are still using it?
So that's a very good question. Many studies have looked at the risk factors that predispose caregivers to using corporal punishment. And what they have found was that adults who experienced corporal punishment as a child are more likely to express a favorable attitude towards corporal punishment as parents. And one of the most common quotes that we hear is, "My parents spanked me and I turned out okay." So other studies have found that the use of corporal punishment is affected by the caregiver's stress and depression. So if a parent is stressed and overwhelmed, they're more likely to use corporal punishment when disciplining their child. Also, conservative religious and political beliefs, lower socioeconomic status, and lower educational status have all been linked with support of corporal punishment. But the most interesting finding from all of these studies is that the strongest predictor of positive attitude towards corporal punishment is the parent's perception that the professional they were most likely to turn to for advice about discipline approves the corporal punishment. And so when we look at healthcare providers' beliefs and educational practices towards corporal punishment, studies find that nearly 29% of nurses and nursing students endorse spanking as an acceptable method of discipline, and less than 25% said that spanking was never justified. Other studies have shown that only 6% of pediatricians report positive attitudes towards spanking, and 75% disagree that spanking is a normal part of parenting. And it's not surprising that child maltreatment professionals are generally opposed to corporal punishment. So studies have shown that 82% from this group agree that spanking is a bad disciplinary technique, and 74% said it is harmful to children. Some studies show that 58% of parents report that they had never discussed child discipline with their child's healthcare provider.
What can parents do instead of corporal punishment to get their children to behave better?
So all children need discipline to feel safe and secure and to be able to grow and develop relationships. Giving up corporal punishment does not mean letting children grow up without boundaries. So there's some goals of effective discipline, and I want to go through these because they're really important. There's 5 of them. The first one is that children will become able to determine right from wrong without being told. That's an incredibly great goal, right? We want children to be able to, on their own, be able to know what's right and wrong without fearing that they're going to be hit or they're going to be told. The second goal of effective discipline is that children will more likely want to do what's right even when no one is watching. The third goal is that children who do wrong will be more likely to acknowledge the wrongdoing. They will apologize, make up for the wrongdoing if possible, and learn from the wrongdoing not to do it again. The fourth goal is we want a healthier family functioning. And the last goal is children will become responsible adults. Every parent wants this for their child. And so I find it really helpful that we as healthcare providers should really highlight these goals everywhere we can. We can post them, we can have them in clinics and schools. We should have them so parents can read them, look at them, and want to ask you, how can I effectively discipline my child? And so some of the starting points for discussion should include, one, that discipline should be something that parents give thought to and about which parents make plans, not something that just happens. 2, no single approach works all the time with all children of all ages and all situations. That's really important for parents to understand. Another good starting point for discussion is that the difference between discipline and punishment is a child who behaves out of fear of his parents and one who behaves out of respect. And then another good starting point discussion is punishment is an event and discipline is a process. And I also want to talk about the 4 principles of positive discipline. The first one is that behavioral expectations that are developmentally appropriate. So an example of this is infants and young children, for instance. They have a very short attention span. So generally, they can focus on only one thing at a time and can be easily distracted. And so if we teach this to parents and we explain how this is expected behavior in infants and young children, then when parents are aware of this, they accept the behavior as normal instead of viewing it as misbehavior, and they offer solutions such as bringing a toy or snacks to keep the child busy or distracted. or instead of yelling or hitting the child when they act out of frustration due to their short attention span or their distracting behaviors. Another principle, or the second principle with positive discipline, is the establishment of ground rules for specific situations. And so for an example, in a school-age child and teenagers, this works really well. You sit down as a family and you set rules for curfews or chores or talking back or homework or phone use, anything that is important for you as a family. And you choose consequences for breaking the rules, and you make sure that they are appropriate. You sit together as a family when things are okay, not in the middle of a negative situation. The third is you want communication about the rules in a language that the child can understand. And we all know, as healthcare providers in pediatrics, that the way we speak to a 6-year-old is really different than the way we communicate with a 16-year-old. So let's make it language appropriate. And then the last principle is to be consistent, is to consistently enforce the rules, or consistent enforcement of the rules. So you want to choose consequences for breaking the rules, and you want to make sure that they're appropriate. And when the rules are broken, we want to always be willing to listen to the child's reason. If she feels that the rule was unfair in a certain case, or she feels breaking the rule was beyond her control, sometimes she'll be right, and we want to be able to listen to her. Most of the time, she'll just be rationalizing, and the consequences should be enforced. And so we can respond or state something like, I'm glad you told me how you see this, but I disagree with you this time, and the rule still stands. So what we do know for sure is that positive attention reinforces good behavior and reduces the bad behavior. So instead of punishing negative behavior, we should try to catch kids being good. Children want the attention of their parents. And if the only way of getting that attention is to misbehave, they'll misbehave. So catching children behaving well and praising them or rewarding them is really, really important. An example of this is, I'm going to read to you an extra bedtime story tonight because I am so proud of you for sharing your toy with your brother, rather than paying attention to when she purposely takes away the toy from the brother. One good resource that I use a lot and is available for parents is the Centers for Disease Control. The CDC, it's www.cdc.gov. They have an age-specific handout on positive parenting tips. If you enter into the search of the cdc.gov site and put development positive parenting, that will come up. I always make copies of that and always have it available because it's a really good resource for parents.
How can NPs discourage corporal punishment and encourage positive discipline in their practice?
Parents really do listen to their healthcare providers. Our relationship with our families we care for are typically characterized by trust, warmth, and respect. Nurse practitioners are really in a unique position to encourage the use of positive parenting instead of corporal punishment. I believe that at every child care visit, all healthcare providers should be asking, what do you do when your child misbehaves? This starts the conversation, and we want to follow it up with, and how is that working for you, your family, and Johnny, the child? You want to keep in mind that, like any other behavioral change, it requires multiple conversations. So you want to follow up, make follow-up appointments, and you want to be able to spend as much time as you can with this preventive effort. It's not just a one-time conversation. So when we have discussions like this with our parents, we are decreasing the chances of our patients being physically abused, developing physical and mental health issues due to corporal punishment, and improving the overall health of all of the family members.
What preventive efforts are available at the community level?
So it really does take a village to raise a happy, healthy child. And this includes everyone in our community. And there are many things that we can do. So children spend more time in school than they do anywhere else. Protecting Our Students Act of 2020 is a bill that has been referred to the Education and Labor Committee. This bill would prohibit the use of corporal punishment of students by school personnel of any school program that receives federal financial assistance. This bill is worthy of support, and all nurse practitioners need to write or call their local representatives to make sure they are aware of the bill and to understand how supporting this bill helps the United States in shaping our laws to better protect the physical, mental, and emotional well-being of our children. Another thing that we can do is the no-hit zone. The no-hit zone is a national initiative that encourages positive parenting and discourages corporal punishment in all areas of the community, such as churches, religious organizations, schools, hospitals, and all institutions where children are a part of. The goal of the no-hit zone is to create an environment of comfort and safety for parents, families, and staff in every facility. It sets a precedent within the community and establishes a commitment to the promotion of effective parenting techniques by instilling a few things. So it focuses on no adult shall hit a child, no child shall hit another child, no adult shall hit another adult, and no child should hit an adult. The nohitzone.com provides toolkits and resources for anyone interested or any community center interested in joining this movement. NPs can play a vital role in building a safer, healthier future for children. From individual caregivers to national policies, nurse practitioners have the power to protect children's safety and encourage healthy development. Thank you so much for inviting me to talk about this really very important topic.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.